Imagine this. You've just gotten into an accident and they're about to take you by ambulance to the hospital. Instead of worrying about your well-being, your first thought is, how will I afford this? If this is relatable to you, are you ready to take a stand for change in the reform of the American healthcare system? According to AMJ Public Health, we used to say that the United States shared with South Africa the distinction of being the only industrialized nation without universal health insurance. Now we don't even have South Africa to point to. Almost 20% of the non-elderly population in this country lacks health insurance at any given time, and the disparities in access to care and health outcomes are very much greater in the United States than anywhere else from which there are reasonable data. The U.S. has the most expensive healthcare in the world with the lowest coverage. We are also the only country without universal health insurance. Shouldn't we be receiving more for all the money we're paying for health coverage? As someone who has a lot of medical expenses, I would like to show you why universal healthcare is vital for this country. I struggle with mental illness, therefore I require a lot of doctor visits and a lot of medications. If I were to get too old and lose my health care, I wouldn't be able to afford my medications. This could be very dangerous. There are many people just like me that require health care to be able to function normally and live their daily lives. I had my appendix taken out last July of 2020. They went through 2 insurances, my mom's as well as my dad's, which I am covered under. My mom is still paying medical bills from this. This just goes to show how dysfunctional the American healthcare system is. A lot of specialty doctor visits have a copay of between $50 and $60. This is an 8-hour workday for some people. In 2020, we saw a pandemic hit our country hard. Millions have been infected with the COVID-19 virus and hundreds of thousands have died. Many insurance companies have stated that they will not cover anything to do with COVID. This is a scary thing for long haulers. Long haulers is a term for people suffering with COVID symptoms months after being infected. The cost of medical expenses in the U.S. healthcare system could come at the expense of lives. I once met a lady at the pharmacy who had been without her insulin for 2 days because she could not afford it. Despite spending more on healthcare than comparable countries, the U.S. has the lowest life expectancy and performs poorly in a variety of health outcomes. Thus, our complex network of insurance plans is wasteful, in large part due to high administrative costs and lack of price control, says Harvard Health Publishing. All insurance companies have case managers which review and approve things such as medical procedures, tests, medications, length of hospital stays, and many more health needs. I've experienced this firsthand. I needed a specific medication as it is the only one I had any luck with actually working. My insurance refused to pay for it because it was a newer medication. Notoriously long wait times in the ER have led to death among people waiting to be seen. Americans go to the ER in times of need. They expect to be taken care of and feel safe by putting their lives in the hands of specialists. For 58-year-old Michael Herrera of Dallas, help never came. He died of a heart attack last week, an estimated 19 hours after he arrived at Parkland Memorial Hospital's emergency room waiting room, complaining of severe stomach pains, according to reports from WFAA News in Dallas, says ABC News. The VA healthcare services fall into line with private healthcare as well. There have been people who have died because they were on a waiting list to be seen by a doctor and it took too long. According to NCBI, the cost of cancer is expected to hit up to $173 billion in the year 2020. Cancer is one of the leading causes of death worldwide. As you can see, people are in need of affordable health care. Universal health care would help achieve this. You can help by advocating and petitioning for universal health care. Some say the government shouldn't be in charge of health care. According to U.S. News and World Report, among industrialized countries with comparable levels of economic development, government-provided healthcare is much more efficient and more economical than the U.S. system of private insurance. According to NCBI, healthcare is one of the most significant socio-political topics in the United States, and citizens currently rank healthcare as the most important issue when it comes to voting. The U.S. has historically utilized a mixed public/private approach to healthcare. In this approach, citizens or businesses can obtain health insurance from private insurance companies, while individuals may also qualify for public government-subsidized health insurance. In contrast, the mass majority of post-industrialized, westernized nations have used various approaches to provide entirely or largely governmentally subsidized universal health care to all citizens regardless of socioeconomic status, employment status, or ability to pay. The World Health Organization defines universal health care as ensuring that all people have access to needed health services of sufficient quality to be effective while also ensuring that the use of these services does not expose the user to financial hardship. Importantly, the Obama-era passage of the Affordable Care Act sought to move the U.S. closer to universal health care by expanding health coverage for millions of Americans, including for citizens across income levels, age, race, and ethnicity. Shouldn't seeing healthy people be a drive to initiate change? Imagine this. Universal health care is in place. You get into another accident. This time the thought of how you're going to pay for the ambulance ride and trip to the hospital never crosses your mind. You're able to solely focus on your health. This could be the outcome if we could gain access to universal health care. The closest we came to universal health care was the Affordable Care Act, or Obamacare, in 2010. According to NCBI, the Affordable Care Act is a watershed in U.S. public health policy through a series of extensions of and revisions to the multiple laws that together compromise the federal legal framework for the U.S. healthcare system. The Act establishes the basic legal protections that until now have been absent. A near universal guarantee of access to affordable health insurance coverage from birth through retirement. When fully implemented, the Act will cut the number of uninsured Americans by more than half. The law will result in health insurance coverage for about 94% of American population, reducing the uninsured by 31 million people, and increasing Medicaid enrollment by 15 million beneficiaries. Approximately 24 million people are expected to remain without coverage. Did you know mothers and fathers are charged for skin-to-skin contact with their baby after giving birth in the U.S.? Earlier this week, a father uploaded his family's hospital bill for his child's recent cesarean delivery. The reason the bill went viral, an itemized listing for skin-to-skin after C-section, $39.35, quantity 1. Yes, this new dad had to pay money to hold my baby after he was born, as he put it, says Jennifer Austin. Imagine being charged to hold your baby. This is the result of ridiculously unreasonable private health care. No one should have to choose between living expenses and being healthy. So I encourage you all to take a stand with me and advocate for universal health care. Help Americans stay healthier and less stressed. Now I will be having a 2-minute question and answer.
How do countries pay for public health insurance?
Well, a lot of countries mix paying with payroll taxes, employer contributions, and general government revenue. They also do progressive or SID taxes. There isn't one model to follow. Each country has its own health funding plan that has been reformed to meet the needs of their current system.
Do solutions exist within the U.S. that can be applied to the rest of the world?
I would say no, because there's a very complex system in place.
What are the biggest hurdles to any future health reforms in the U.S.?
I would say partisan politics. The Democrats and the Republicans often fight over things such as Medicare for all or universal health insurance.
If you could change one thing about our healthcare system, what would that be?
I would say the financing. I would make major changes in the tax code and other laws and regulations.
What works in our system and what doesn't work?
Well, we are the world's leaders in medical science and technology. We have superior medical schools producing highly trained physicians and specialists. In sheer numbers, Americans outclass every other country in the world for capturing the Nobel Prizes in medicine. Since World War II, we have been the beneficiaries of pharmaceutical revolution that has dramatically improved the strides of improving diagnostic technology. So we are getting a good return on our healthcare dollars invested in biomedical research, science, medical technology, as well as education of our medical professionals. What doesn't work is the financing of our healthcare system, both the public and private components, and the laws and regulations governing our insurance markets. Tax law and regulations discriminate against Americans who do not or cannot get health insurance through their place of work. Thank you.